Well, it's always nice to speak to someone who has been a patient and currently a patient at Breastlink. It's nice because we find out how they're treated over there. You get an inside view, and their patient experience is what Breastlink is all about. And I'd like to welcome today Christine Johnson. Wonderful for you to be here today.
Thank you so much for having me.
So tell us about not only your experience, you actually are ongoing, and tell us about your kind of journey with Breastlink, if you will.
Breastlink, well, I met Dr. Curcio some years ago when she was in Mission Viejo as a patient, and I had some ongoing issues, and I continued with her, following her over to Breastlink, and at which point she followed me closely.
Okay.
There had always been some concerns from my very first mammogram at 38 years of age. So she followed me very closely. I continued to have problems, and she was just proactive, extremely proactive. She never hesitated on doing any type of testing, or she never discounted any of my complaints or my concerns. So that's pretty much how I ended up at Breastlink. Was through Dr. Curcio and through my concerns.
And one of the things we often hear about Breastlink is exactly what you said. It's really, they're not just going to be the clinical part of it, which of course is very, very important, but it's the human side, the fact that they really get to know their patients. They often have people there who are volunteers who've gone through similar experiences, so they can sit down with someone and tell you, here's what my experience was, what you're going to probably go through, your emotions are going to be, and that sort of thing, right?
Correct. Yes, they do. They have a phenomenal support system. From the time you walk into the door, the staff, I mean, the ladies in the front office are just phenomenal. From the front door to radiology, to the doctors, to everyone, just everyone there. I can't say enough positive things about Breastlink. I just can't. They are just phenomenal. I mean, it's a process that if you have to go through, I recommend them highly. I tell all of my friends that if you live in Los Angeles and you have to make the drive to Orange County, if you can't find a Breastlink right by you, it's worth the drive, because when you get there, you're gonna just be totally comfortable, and they are so concerned. It's like a family. You feel like you're in a family environment. And when I've gone there, my husband has gone with me, and he was like, I can't believe you do this much smiling and you're laughing when you go to the oncologist. Yeah. And I do. I have a great time when I go there, because I know I'm going to get supported. I know that. So
obviously, it's, no matter how good an experience is, it's a very difficult time and a difficult experience.
Yes.
And the most important thing is not only you're getting the top-notch treatment that you've been receiving, but then beyond that, if you need reconstructive surgery, and this is something you're kind of going through now, am I right?
Yes, currently I am going through reconstructive surgery. I had a double mastectomy in 2015, and I started reconstruction immediately after the double mastectomy. I did hit a few roadblocks. I had to have 4 subsequent surgeries back to back, because I did incur a infection and a rejection of the device. So I did go through some times there that were a little rough. And the reconstructive part, I'm back in it now. I'm currently treating with Dr. Gown, who's in Newport, who's also a physician at Breastlink. And I'm doing fairly well, I would say. I'm probably maybe about 8 weeks out of having my reconstruction surgery done. And it's a long process. I had a latissimus dorsi, where they take the back muscle and they move it around to incorporate and get ready for breast implants at a later time.
So you've been going through this now for what, almost 2 years? From the start to this point? From 2015 to now, or about
2015 a year? Was when I was actually diagnosed with invasive ductal carcinoma, and to the current, I'm still treating. So it is a journey. I do have a little ways to go before we're all complete, but I just know my team at Breastlink, I have no concerns. I don't. Even when I had some issues, I still kept a smile. I just knew I was going to be okay.
That's
I had
great.
the reassurance, I'm sorry, through Breastlink that I was going to be fine.
And have you done some volunteering with them as well?
I have. I've done a limited amount of it, but I am on their support team as far as being a volunteer. I have spoken with a woman in the past, so I've done some phone consultations, and I've gone in the office on an occasion to just kind of help with facilitating the patients through and getting them triaged and back to the doctors.
Yeah, and that's, as you know, it's very, very helpful, isn't it?
Yes, it is. It definitely helps to have a woman that has walked that journey and be able to help you through, as well as with Dr. Curcio herself, walking us all through it. So.
Yeah, definitely. Well, it's been a pleasure meeting you.
It's been a pleasure
I
as well.
obviously wish you good health and speedy recovery. I know you're in great hands.
I am.
I hope everything goes fantastic for you. And maybe we'll see you back here again if you're still volunteering for them.
Thank you so much.
Wonderful.
Thank you so much for your time. I appreciate it.
Thank you very much, Christine.
All right.
All right, Breastlink, Laguna Hills, and I think when you hear from someone who has gone through and is currently going through the experience with Breastlink, you hear how positive it is. Great folks over there, as you know, and thank you again for coming on. We appreciate it. We'll be right back.
Thank you.